Hello, in this video we're going to review blood preservatives that are used in blood storage and which eventually are given to the patient together with the blood product of choice. The solutions that are added in the blood bag have a dual function. They act as anticoagulation agents and as red blood cell preservatives. These preservatives provide proper nutrition to maintain red blood cell viability, function, and metabolism. Adverse reactions may occur in some patients as the result of added preservatives. For example, citrate is used as anticoagulation agent in most blood products. Citrate binds with free calcium in the donor plasma. Blood will not clot in the absence of free or ionized calcium. However, if too much of this citrate-rich blood has been given to the patient, that citrate will bind to patient's calcium and deplete patient's calcium, leading to arrhythmias and spasm. Other preservatives are citrate phosphate dextrose, acronym CPD, citrate phosphate dextrose solution with acronym CP2D, citrate phosphate dextrose adenine with acronym CPDA-2. There are also additive solutions, sodium chloride, dextrose, adenine, and mannitol. In addition, refrigeration to 1 degree to 6 degrees Celsius preserves red blood cells and minimizes the proliferation of bacteria. Citrate phosphate dextrose, CPD, is added preservative. Phosphate is added to buffer the decrease in pH. The compound in red blood cells that facilitates the transport of oxygen is 2,3-diphosphoglycerate, 2,3-DPG. When the pH of the blood drops, which is blood becoming acidic, there is a decrease in 2,3-DPG, and therefore a lowering capacity of blood to carry oxygen. The 2,3-diphosphoglycerate levels remain higher in blood stored with citrate phosphate dextrose than that in the blood stored without phosphate preservative. All these additives and preservative add to shelf life of 21 days. Next, citrate phosphate dextrose solution, CP2D, also has a shelf life of 21 days, but here they simply added extra dextrose. Next, citrate phosphate dextrose adenine, CPDA-1, shelf life is extended to 35 days. CPDA1 contains adenine, which helps the red blood cells synthesize adenosine triphosphate during storage, the famous ATP. There are 3 forms of additive solutions: SA1, SA3, and SA5. Something happened to SA2 and SA4. I think they didn't work. Additive solutions contain sodium chloride, dextrose, adenine, mannitol, and other substances that support red cell survival and function for up to 42 days. Red blood cells prepared with SA1, SA3, and SA5 have better flow rates and do not require dilution with saline. However, saline is isotonic solution for red blood cells. Dextrose acts as a nutrient, ATP production. Adenine also supports the ATP synthesis. Mannitol is a nutrient and it reduces hemolysis. So hypercalcemia is a major concern related to additives to blood products. Hypercalcemia is an adverse reaction that can occur when large amounts of citrated blood is infused or small amounts infused in a person with impaired hepatic function. Liver is responsible for breaking down the citrate anticoagulant. And if there is liver cirrhosis, hepatitis, or other pathology of the liver that causes liver to work insufficiently, citrate will rise in the body and lead to hypocalcemia, which will lead to arrhythmias and spasms. After all is said, hypocalcemia can be treated with supplemental calcium, IV or oral, and close monitoring of calcium will be necessary in a situation where large volumes of blood products are given, or the patient has an underlying condition of liver malfunction. So you have just made it to the end of the video. If you found the video useful, please click that like button. I hope you enjoyed it. Thank you for watching, and I wish you great success.